Hey everybody, how you doing? Dr. Rob here. Hope everybody had a great Labor Day weekend. I'm here to talk about low-level laser and its benefits for you. As everybody knows, I use low-level laser in my office. I use it on as many patients as I possibly can. I've used laser for about the last 10 years. I use the Zirconia laser an awful lot. A lot of people ask me about laser, what conditions does it help? What do you have? So I want to go through some different things. It's going to take about 20 minutes. I'm happy to answer questions, so feel free to ask some particular questions. A lot of people, when it comes to low-level laser, hey Siri Wan, how are you? They ask me a lot of interesting questions on laser in that how does it work? Because the laser that I recommend people don't feel. I'm going to go through all this. So again, feel free to ask questions. It'll take about 15 to 20 minutes and then we'll get to all the questions. The big why. People always ask, why do I use laser? Well, laser's been proven to be extraordinarily effective. It actually works at the speed of light. When I say the speed of light, it's photons. Photons go into the air and get absorbed by the body. The lasers that I use, again, the Zirconia lasers that I use are research driven. They actually have 18 out of 21 FDA clearances granted in the United States today. In addition to that, we've got a lot of empirical studies. Done a lot of lecturing around the world, and nationally and internationally, if you will. And a lot of docs have used lasers implemented in their offices, in their protocols. And interesting in that they've all mentioned like it's been a game changer. It's changed how they practice. They've been able to treat this condition with it and that condition. So when you combine the research, empirical on your own, studied and FDA cleared, you really have got a bona fide lot of good quality information. It's practice building. So any of the docs out there that are considering it, why don't you DM me, reach out, ask me about it. It's practice building. It's revolutionized my practice. People are asking for it. As everybody knows, I have 21 years of practice. I have 6 degrees in nutrition. I do a lot of what we call functional medicine, functional nutrition, trying to look at the systems, not the symptoms, trying to get to what we call root cause resolution to personalize the lifestyle effects for everybody. That's a nutritional aspect. In addition to that, I obviously, you all know I use laser, I do active release, I do instrument assisted, I do a lot of exercise rehab, I do taping, I do a lot of functional assessments, and we're always adding new techniques to enable us to get a better outcome with all the patients. So it's been practice building. It's got FDA clearances for joint health. So I'm going to go through some of the different FDA clearances throughout this video, and it's been great for brain health. When I talk about brain, I think this is where the laser is going to fall, truly with the brain health, in that I'm using it for concussion and a lot of neurodegenerative disease. It's real simple. We get a lot of energy, and the number one area that the laser helps people is in the mitochondria. The number one mitochondrial part of your body is, without question, your brain. So let's take a look at this. I've got my little slide decks over here. We're getting a good amount of people looking in. So you know what? Hey Siri Wan, hello from Holland. Hey Ryan, I appreciate you reaching out to me. I can't tell you how much I haven't heard from you lately, so I hope all is well. You're looking great in your pictures. Keep up the good work, everybody. Feel free again to ask the questions. So let's talk a little bit about what laser is. Laser focus. Laser is an acronym. It actually means light amplification by stimulated emission of radiation. It's a focused beam of light that emits photon energy. All photons traveling in the same direction at the same wavelength equal coherent light. Coherent light is a critical element. What we mean by coherent light is that all the waves are the same. It's like this perfect wave. A surfer would love it because he'd be able to get in and out of the waves. So coherent, non-scattered light is a critical element. We also use synonymously low-level laser with the idea of photobiomodulation, or low-intense light therapy. It's photochemical. So photons go in and give a chemical reaction. It's not thermal. So many people ask me, does it generate heat? No, you don't. I repeat this. You do not want to generate heat. Heat in most instances is deleterious to overall health. You want the energy. You want to mimic the sunlight. You're doing so without the heating aspects, with the photon. So for me, I like to call it electromagnetic transfer of energy. So the laser allows those photons to go in chromoflores in the body, absorb them, they bring them into the body, they cascade, oxygenation, neurotransmission, ATP. You're allowed to heal at a cellular level. So light is really triggering biochemical changes within the cells. Best way to describe it, it's photosynthesis in plants, and photons absorbed by cellular photoreceptors and trigger chemical changes. So there was a study that came out in 2015. It talked about the anti-inflammatory effect of a 635 nanometer laser. So the red lights, when you see, I'll post a video of me with a red and a violet light. The red light you'll see is a 635 nanometers. So the color, which is red, depicts the wavelength. So between 630 and 640, a lot of really good literature. And what they found out, it actually decreases inflammatory markers in your body, decreasing specific pathways called COX-2 and PGE2. Both are pro-inflammatory mediators. Interesting. So lasers also been used for pain relief. It increases metabolism and the transport of action potentials in neurons. What we mean by that is peripheral nerves have action potentials. Rockkind did a ton of literature studies and proved that by adding this 635 nanometer red light, you were able to get a better action potential. So what do I mean by that? Peripheral nerves, like sciatica, really good outcomes because you're able to add the light, the laser light, to stimulate the healing and what we call an action potential and fire through. So having said all that, I strongly recommend for those who have, again, any kind of peripheral neuropathy, carpal tunnel, sciatica, and the like, really take a good look and consider adding the laser into your armamentarium. Now, I do the laser with nerves with what we call the nerve flossing. So I'm moving the nerve, not trying to get too heady. We're moving the nerve back and forth. And in that we're moving the nerve back and forth, we provide a nerve floss. You add the laser to the nerve floss, really good clinical outcomes. Interesting study that I have over here. It was 70 people who had bilateral tricompartment need for, they had osteoarthritis and they had need for bilateral joint replacement. So in that joint replacement, there were 70 people. Interesting, on the left knee, they added physiotherapy and what we call a sham laser. On the right knee, they added physiotherapy and a real red laser. On the left knee, which was physiotherapy and a sham laser, what you saw was it went from 70 people needing a new left knee down to 15. Tremendous drop. Whereas on the right knee, you saw it with the real laser and physiotherapy exercises, if you will, it went from 70 to 1. That's a precipitous drop. In that drop, what you saw was almost nobody needed a joint replacement. So think of being able to avoid joint replacement. Think of the savings on our healthcare system. That was a study in Clinical Interventions of Aging, August 5th, 2015. Low-level lasers work truly by helping the body marshal its own energy and its own cellular resources to heal itself with no side effects. There's been more than 3,000 publications and over 200 clinical trials with what we call positive outcomes, and it's growing every day. So my takeaways on low-level laser is, here we go. Everybody, there's 5 quick, real easy takeaways. It controls pain, it reduces inflammation, it increases blood flow, it stimulates nerve tissue growth, and improves memory and focus. One of the things, I was just away and I was talking with a couple of docs that also lecture on the laser. We talked about preconditioning or prehab with low-level laser. So lasers can be used in a preconditioning mode. This way the muscles are protected, nerves feel less pain. You can prevent pain in general. You increase healing after surgical procedures, and without question, you can increase athletic performance. So many people don't realize that laser can be used to improve athletic performance because you're increasing the utilization of ATP. That ATP allows for more contractile or relaxation of muscles. It's a critical element to allow those fast twitch fibers to fire. So many people ask me, we talked about the red light, what about this violet light? The violet light, which is a 405 wavelength, is vastly different than the red light. We know that the red light works with all these different structures, muscles, ligaments, tendons, cartilage, peripheral nerves. It helps with wound healing. It's great to add with the brain. What does the violet light do at a 405 wavelength? Well, one thing is the lower the wavelength, the more energy. So a 405 violet light has this great ability to allow for that electromagnetic transfer of energy at a greater level than the red. You combine the two, you're really imbuing the body with a lot of energy to be able to cause a quick healing process. The violet light stimulates more of the sympathetic nervous system. The red light does more of the parasympathetic nervous system. The violet light is known to help with bacteria, fungus, virus, pathogens, and the like. So it helps with the immune system. And I use the violet light in an interesting manner. I use the violet light also to, if you would, uncloak of the condition. It allows the hidden weakness because it's simple to show, that hidden weakness to show. In that, if we're able to add it to an area, you're really adding a sympathetic overload to the area. And if that area, which looks strong and movable, can't handle the sympathetic response, you know that there's a hidden injury. So I actually use the laser in a, if you will, a diagnostic manner. So I use the violet light for the vagus nerve. Vagus nerve, medulla oblongata down through the transverse colon. It is a critical element. It is the key to the bidirectionality of the communication between the gut and the brain and the brain and the gut, without question. Vagus nerve, cranial nerve number 10, the king of the parasympathetic nervous system. The vagus nerve also runs what we call the enteric nervous system. Your gut is your second brain, and the reason it's a second brain, it has its own nervous system, which is the enteric nervous system, which has more nerve cells than any other system. Your vagus nerve is in charge of the enteric nervous system. So many medical doctors are trying to stimulate the vagus nerve, some of which are doing that through surgical procedures. I'm not big on those type of surgical procedures. I found in my office that if you have the violet light and the violet and the red, you're going to have a positive effect on the vagus nerve and vagus nerve stimulation, which will lead you down a path of increasing BDNF. It also decreases glutamate excitotoxicity. So the vagus nerve quelches peripheral inflammation. It's also shown to decrease a lot of your IBS and IBD. Vagus nerve also allows, as I said before, that communication between the brain and the gut and the gut and the brain. Some real factoids, if you will, that I wanted to share with everybody. Stimulating the vagus nerve has shown to prevent intestinal dysfunction after traumatic brain injury. Everybody knows I treat a lot of concussion. I've dedicated a whole chapter in my upcoming book, which will be out in January, February of 2021, called The Superhighway to Health, to concussion. I've actually dedicated a whole chapter to the vagus nerve. Vagal nerve stimulation prevents TBI-induced intestinal permeability because it reduces intestinal release of NF-kappa B. So what happens is when you hit your head, you damage your gut. So when you hit your head, you damage your gut. Whatever you do to your brain, you do to your gut. Whatever you do to your gut, you do to your brain. Vagal nerve stimulation actually decreases the incidence of epithelial breakdown at your gut level when performed within 90 minutes. It actually prevents damage to what we call our tight junctions. We've gone through tight junctions before. Here's our epithelial cells. Tight junction is like the gate to opening your gut to all sorts of pathogens to come through. There was a study that was done with mice. They did a sham, and they took a microscopy. They gave a mouse a TBI, and they treated mice with TBIs and vagus nerve stimulation. So if you were to see the sham, you would see that, of course, obviously the gut is in perfect condition. After a TBI or a concussion, the gut is perforated. They have intestinal permeability and the such. The other slide, if you could visualize it with vagus nerve stimulation, if you stimulated the vagus nerve after a TBI, 30 days later, the gut looked the same as if it was never injured. So anybody who has a concussion, anybody who banged their head, anybody who's worried about brain to gut or gut to brain, you may want to give me a call. We can talk about it, and you may want to search out somebody who has the ability to do a vagus nerve stimulation. One of the lasers that we use here is the FX635. In that FX635 is very interesting in that the FX635 has a multitude of FDA clearances. It has an FDA clearance for plantar fasciitis of 6 visits. I mean, if you've ever had plantar fasciitis, about 10 million Americans have plantar fasciitis, you will see that plantar fasciitis is painful as heck. And it was 6 visits, and plantar fasciitis was relatively ameliorated in pain and continued to feel better months later after stopping treatment, which really speaks to the systemic global effect that laser has on people, because it's stimulating healing and it's putting your systems, your body systems, with the right energy on a healing path. Another FDA clearance that it has is for chronic lower back pain, and that happens to be over an 8-visit period. So 8 out of 10 Americans have lower back pain. It's great to see that you've got a low-level laser. Now, for me, when I add the laser with that FDA clearance, and I do it with flexion distraction, active release, exercise rehab, nutrition, weight loss, we're getting really good results. We're able to help a lot of people. And that was the reason that I wanted to get the laser in here. I wanted to help myself with my torticollis. I wanted to help other people once we found out that it worked. So that FX635 is quite exciting. And last, it just last year received an FDA clearance for nociceptive musculoskeletal pain. So any body part. Now let's break that down a little bit more. So there's a study that showed in nature.com April 4th, 2017, that low-level laser actually elevated interleukin 4 and 13. Those are two of the positive interleukins. So the results showed that laser had potential for reducing inflammation, regulating your macrophages and your microglials, your captains of the ship of inflammation in specific areas of your body, and it actually allowed you to promote neuronal survival. Laser may be an effective candidate for the treatment of spinal cord injuries. Now, inside what we call the annulus, or the microenvironment part of the disc, so there's your nucleus, there's your annulus. What they found out was that the inflammation, specific interleukins that are inflammatory, were elevated. Those interleukins that were elevated, that were inflammatory, were interleukin 6, which is very high in the cytokine storm, and interleukin 8. The violet light spoke to the decreasing interleukin 6 in the spine, and the red light spoke to decrease in interleukin 8. So now we have in our office what we call an FX405. In that FX405 has both a red and a violet light. Low-level laser was shown in a study in 2018 to actually decrease interleukin 6. Some of the benefits of the tissue effects of low-level laser can include almost all tissues and organs of the body: blood, epithelial, joint, muscle, bone, neuron, and connective tissue. So, I mean, we've talked about that. There's literature that's backed up that statement for about the last 11 years. And, you know, shining the light on the head. I wanted to get to that. I want to keep it in 20 minutes. I want to see any questions that we may have. I want to do some shout outs and things of that nature. So everybody should notice neuroscience research published November 13th, 2017, spoke to the idea of putting the putting the red light on the head, all the things that happen, all the positives. So essentially, virtually everything that goes negative inside your brain can be reversed according to this study in 2017. So what happens is when you add the red light to the brain, you get what we call angiogenesis, the growth of blood vessels. You get decrease in brain edema. You get increase in lymphatic drainage. You get an increase in blood flow, cerebral oxygenation. You get an increase in BDNF, brain-derived neurotrophic factors. BDNF allows for brain neurogenesis, and it's also very anti-inflammatory. So all these things that you look at, and decreases excitotoxicity. So all these things that create a microenvironment in the brain after concussion of inflammation and damage, the laser in this study can reverse. And we've seen a lot of really good outcomes adding laser into our treatment protocol to really help people get over any kind of brain trauma injuries. The 635 nanometer, which is what we like to use, the red light, modulates the NF-kappa B signaling pathways. Laser was shown to mitigate cell apoptosis. It's also ascribed. So many people say, well, how does it work? Well, low-level laser suppresses pro-inflammatory cytokines, as we said before. So the true protective effect may be ascribed to enhanced ATP production and the selection modulation of pro-inflammatory mediators. So it decreases, again, inflammation in the brain and allows for healing through different parts of the body. You know, most interesting, I found how synergistic low-level laser is with my other chiropractic treatments, whether it be nutrition, whether it be exercise rehab, whether it be adjustment, and the like. So let me go through this. I saw a whole bunch of shout outs. Hey Mia, how are you? Hey, how are you? What's it about? Wow, Robert Jacobs, how are you? So got a couple of quick questions. People ask, why is heat bad? So that's a great question. One of the reasons that heat is bad is heat may not be bad, but heat can be damaging to tissues. You don't want to heat an acute condition. You don't want to heat your, sorry, I got a little technical thing there. You don't want to heat a nerve. You don't want to heat your brain. Do you want to heat a chronic condition? Well, chronic condition was deemed something every other day for over 6 months. So how chronic, or how many people truly have chronic conditions? Chronic in time frame, what we're finding out now is 3, 4, 5 months is really an acute condition over a long duration of time. So when you change that mantra in your brain, if you will, you'll begin to realize that laser, you don't want any heat. And the reason lasers heat typically is at longer wavelengths, too much power, push through. So I'm not a big proponent of heat. I like the photochemical effect. People also ask, can you do exercise with it? And it's funny, they must be reading my mind. Without question, I add exercise with the idea of low-level laser, without question. So I do a lot of exercise rehab. I'm big on bracing in the abdomen. I'll use laser when people do the Brugger technique. So yes, I'm a big proponent of adding active exercise. For me, the best treatment is active motion with the laser. So when you understand that, what the red light does, the violet light, and the combination of the two, I know some people had to go. They say goodbye. Others are just popping in. When you combine the red and the violet laser, that's where you get the sweet spot. And that's what I think. And the sweet spot is because you get the combination of specific properties. Number one, you're getting a balance between the parasympathetic and the sympathetic nervous system. So you're working with the autonomic nervous system. When you add in the fact that the red light does all these structures, muscle, bone, tendon, ligament, and the violet light adds fascia, which is the saran wrap of the body, now you're getting the whole kit and caboodle, the whole composite of all the structures going from bone all the way, because fascia, which holds the body together, fascia is sort of like when you take the skin off the chicken, you see that white film, that's fascia. Fascia is also what we call an intracellular communicator. So in that intracellular communicator, it allows to communicate inflammation, which we don't want, or non-inflammation, which obviously you want. So that combination of the two, which are the EVRL and the FX45, are my two favorite to go to. Does the violet light affect mitochondria in the same way the red light does? Great question, Rob. Thanks for asking me. It affects the mitochondria more because the lower the wavelength, and 635 is relatively low, 405 is real low, the lower the wavelengths, the more energy. So if you take the standard hot laser, which is an 810 wavelength, and you go to 405, you're getting 100 times more energy per second. You're getting about 60 times more energy just going to the red light. So the violet light, even more mitochondria, has more physiological energy. That's why we don't use as much power in that particular laser versus all the other lasers. So I got one more question. That's a good one. Do I use it to help heal the gut? Yes. Yes. So when you look at a leaky gut, if you will, I use both a red and a violet light. And the reason I do so is you use the red light to help with the wound healing, the epithelial cells to heal. Use the violet light because it's antimicrobial, antifungal, antibacterial, and the like. The combination works really well. And then, of course, I do my vagus nerve stimulation, and we get really good outcomes in conjunction with my 7R action step. So that looks like all the questions today. I really appreciate everybody's time. We try to keep it under 25 minutes. Do me a favor. Please like this. Share this, comment. If you can't see it live like you did now, please share it Memorex. It's all about laser. It's all about you guys. You know, so many people ask me, like, what are you doing with this COVID? You know, yes, we have the mask, masketta, and we wear it. You know, I've got all my gloves here. We're real cautious, etc. Rob Jacobs is sending, you know, brain overload. Thanks. It's always a pleasure. It's always a pleasure to share information. So everybody, you know, let everybody know about the information we have here. We want to share it every day. We try and do it really raw. I try and get some slides up here. I'll try and talk to you. Without question, the stuff we do, we replicate in the office. We're not just talking about it. And a lot of people want to know where to go to trust somebody. Feel free to reach out to me. Hopefully you guys can all trust me. It's been my pleasure. Dr. Rob, always yours in health.